Hi everyone, I'm Dr. Nicole Robinson with Synergy Chiropractic Center, and I'm a functional medicine pharmacist. Today I wanted to share with you some lab results that I just got back. So if you've watched any of my previous videos, you know that there were numerous health issues that I had struggled with for a long time. Digestive issues, heavy periods, being tired all the time, and that's just kind of the tip of the iceberg. And so I started out with working on my gut. I had a SIBO protocol that I went through. I've done things for parasites. So there's really been a lot of gut work that I did, and I do feel a lot better. I would say I probably feel better than I have in about 15 or 20 years, which is truly amazing. And I feel like now I'm ready for sort of that next level of healing. I've got a baseline where I'm doing much better, but there's still a few things that I'm trying to work on. And so I wanted to kind of delve into the area of toxins and heavy metals. And so I did a urine heavy metal test. And here's the results. So I did it through doctor's data, and there are numerous companies you could go through. I don't have any affiliation with doctor's data, but I do use this test. And so as you can see, it's a single urine sample, and it looks at a pretty big list of heavy metals. And as you can see there, I'm all in the green, which is good. There are a couple there though that are sort of inching towards the yellow. So most of the people will fall in the green column. When you start to get the outliers in the yellow and red, that's typically, and I say typically because everybody's different, that's typically where someone would start to experience symptoms of toxicity. Now, a caveat to that though is heavy metals tend to go and settle in tissue, so it can be kind of hard to find them. Urine, hair, blood, even when we're looking for them. So just keep that in mind. This test result is not the end all be all, but I would say that looking at this, I don't have a super high concern for a heavy metal continued exposure or severe toxicity in my case. But it was interesting to me to see higher levels of barium, nickel, and then cesium is, only about halfway. But looking at all three of those, the common denominator is through contaminated food and drinking water, which of course got me analyzing my drinking water situation at home. And confession, I am also a work in progress too, and so I don't really have one of those fancy water filters. We do have groundwater, it's not tap water, although I know that isn't always better in some cases. That isn't always much better, so it is recommended to still get some kind of water, some kind of filter for your drinking water. And so looking at this test and seeing what's kind of high really has me thinking that I probably need to look into some kind of extra water filter for the water in my house. I would be really interested to see what this test would look like after having implemented that. So that'll probably be something in the future that I post about. But I just wanted to give you a little bit of information on this because I know this is probably a topic that isn't super prominent for most people, but it is an area that we don't want to ignore because, we are exposed to toxins and chemicals everywhere we go, and we just never know how they're really affecting us. And so when we've done, like I always start with gut health with everybody, when we've done a lot as far as gut health and we're getting a lot better, but there's just still something that needs to be fixed or removed, this might be one of the areas that we go looking next. Thank you so much. Have a good day. Bye.